Okay, can you hear me online now? Thanks, Portia. We're just going to start over with this slide. Again, thanks to Kathelen and Dan Amos, who are the benefactors of this gift. It is a $5 million gift to be expended over 5 years. This is not an endowment, so all of the money will be spent out. And again, 23 awards of $40,000 will go to recipients. $80,000 is retained back in order to run the program. Folks who are pledging to practice in primary care disciplines of geriatrics, internal medicine, family medicine, and pediatrics are eligible to participate. They have to agree to practice in the state of Georgia, more on the specific selection criteria, because we do look to have this have a state of Georgia-wide impact. Recipients pledge 2 to 5 years of primary care practice, and so it kind of goes like this. So one award of $40,000 is 2 years of pledged practice. 2 awards of $40,000 is 3 years of pledged practice. 3 awards of $40,000 for 4, and then 4 awards is 5 years of pledged practice. So, and that's detailed on your sheet, so you have a chance to look at that. And we're also looking, in addition to giving money to folks so that they can honor their career inclination to choose a career in primary care. We're also using some other resources to support having Emory School of Medicine be a bigger and more supportive environment for people who have a choice of primary care careers. Again, this is a handout that you can actually go to the website and download. If you're in the room, you've gotten a chance to look at this handout as well. There's a QR code in the bottom that'll take you right to the website for the Emory Primary Care Consortium. The Emory Primary Care Consortium, I'm co-sponsor with Lachey Turner, and together we are administering this program. Okay, I'll talk a little bit more about the cycles. Let's talk about eligibility. So if you are here and an Emory School of Medicine enrolled student or an Emory School of Medicine MD graduate, you are eligible for this program. You do not have to do your residency here at Emory or even do your residency in the state of Georgia, but you have to agree to return to Georgia for your practice. Also eligible are Emory School of Medicine graduates who are currently practicing primary care in another state who wish to move back to Georgia. So you're getting kind of the feel of loan avoidance, loan forgiveness, and increasing the primary care supply of providers in Georgia. Those are the 4 disciplines. There's a frequently asked questions page on the website that walks you through some of the questions that several of your colleagues have already asked us. So obstetrics and gynecology is a notable absence here for the primary care program. That is defined as a primary care discipline by some areas and not by others. For the sake of this program, it is not within the scope of the program. There's certainly a short supply of psychiatrists in the state of Georgia, but that is not part of this program either. Again, location of residency doesn't matter. You can leave the state of Georgia and come back. It's your presence as an Emory School of Medicine MD student or graduate. One additional eligibility for geriatricians, given the short supply of geriatricians in the state of Georgia, which is about 100, and there are only about 5 geriatricians trained in the state of Georgia each year. So folks are eligible if they were an Emory School of Medicine graduate who went and got geriatrics training anywhere, or they're a graduate of any other program and came and got their geriatrics training here. So that's one different eligibility for geriatrics career. We walked you through kind of the number of awards to the amount of pledged service just a minute ago. The other thing that we haven't defined is that we've tried to make this program much more flexible than other federal or state programs to allow people to integrate into their lives other commitments and other choice. And so this is a program that requires you to be practicing 0.5 of your full-time effort in primary care. So for example, we recognize that a lot of Emory School of Medicine students and graduates have hybrid ideas about what they want to do with their career. They might want to work for a federally qualified health center and be the director of that health center, and so they wouldn't necessarily practice full-time. As long as that level of practice stays above 50% of your effort, or about 20 hours of patient contact, you remain eligible for the program. So those were eligibility criteria. Now let's talk about selection criteria. So there are 3 steps with selection. One is that you go onto the website and you actually register to be an applicant, and you have an eligibility determination. As soon as we flip that switch on the eligibility determination, it should take us about 5 minutes to determine your eligibility. It's basically, are you a student or not, or did you misunderstand the instructions? We have had one person who trained in residency here but didn't go to medical school, and so we've already talked to that applicant. So these are not necessarily in order of importance, but they are all important. You'll look at number 6. That's not speaking to you as an individual, but rather to us as a program, that we're trying to get representation across all of these 4 primary care specialty areas. Demonstrated an interest and commitment to primary care. Demonstrated indebtedness or other financial need. We recognize that some people's financial need may actually be a family loan or a loan from a business, or some sort of note on some other asset. So we're not asking you to all have the same type of loan or the same type of indebtedness. We're trying to produce a diverse workforce for Georgia, inclusion of individuals who are underrepresented in medicine. We're trying to have geographic diversity in this program. So typically in primary care, most of Emory School of Medicine graduates are mainly in the Atlanta metro area. We hope to recognize and honor some of those folks who are working in different parts of the state. If your employer is a nonprofit, publicly held, or has an explicit and stated mission of service, that's a selection criterion. We would weigh that higher. There are certainly folks who are working in concierge practice. There's nothing wrong with that, but it just doesn't turn out to be as high of a factor in our selection of recipients of this award. And then we talked about the representation to try and get pediatricians and internists and family docs and geriatricians. We are so happy to be doing this like quickly, like now. This is money that was publicly announced on the 24th of September, and we are going to make our first applications due on October 1st. The money came just after Labor Day. We hope to honor the Amos family by getting this money into people's pockets and actually influencing career choices and honoring career inclinations of staying in primary care. The eligibility determination, I'll take you through on the website, or you can even do that while you're looking here. It's basically 3 questions, hit submit. The fastest person to register for this program is 48 seconds. So if you break 48 seconds, that is not a selection criteria, but it's just good. It's just good to be that fast. And again, we will try and award this money before the end of this calendar year, which has tax implications for some folks. There's a fall cycle and a spring cycle. In addition to funding and reduction of loan indebtedness, we hope to create a vibrant and supportive career, a supportive environment for people who are choosing careers in primary care. My own personal experience when I chose a career in geriatrics was that my residency program director said, "You're doing a great job. What would you like to do?" I said, I'd like to serve elderly people. I'd like to be a geriatrician. He said, "You know, there are other careers that you could choose. You could choose to be a cardiologist or a gastroenterologist." I said, "No, I think I'm good. I think I know what I want to do." He said, "Well, you could also be an oncologist." And I said, "No, I think I'm good." He's like, "Okay, well, you don't have to decide today." So I know that some other people have similar experiences when they share with others that, hey, look, I want to be of service to my community in the way of being a primary care provider in one of these disciplines. And sometimes the answer that you get is not as all supportive as it could be. And we hope to create an environment, hopefully a micro environment that grows into a larger environment that supports your career choices and what you want to do. And removing financial barriers is one important part of it, but it's not all of that. So we look to have access to mentorship, sponsorship, coaching, and advising, leadership development opportunities. One of the things that we're doing for this application, because you are required to write an essay, you can repurpose your AMCAS. For folks who are in residency, they can repurpose their ARAS application. But we're also hiring 2 writing coaches that are going to do a group session that'll just give you a life skill of writing a better essay. Not mandatory, but just available. This last one about redesigning to student and resident training opportunities. I did my training at University of North Carolina, Chapel Hill, and I sought out a remote rotation as a trainee and went and lived in another community and worked in a small primary care practice in geriatrics. There's just something to be said for having a diversity of experience and having exposure as a medical student or having exposure as a resident or even someone new in practice to just see other environments. There's just a little bit of work here that we have to do at Emory to make that more easily accessible to everyone. Last night, we had the William Branch Innovation in Primary Care lecture. That'll be available online for your viewing in case you missed it last night. This is AMSA Primary Care Week. Happy Primary Care Week. And also one of the co-authors of this important report from the National Academy of Sciences, Engineering, and Medicine, Implementing High-Quality Primary Care, Integration of Geriatrics and Primary Care, is the Dean of the School of Nursing, Dr. Linda McCauley. And so she has been out and about talking about this report. And I can see that we could have a session with folks who are interested in the Amos program to get a chance to talk to Dean McCauley, who knows a lot about what's happening at the national levels in primary care. Okay, lots of different ways to find out information. All of the three on the left are the same way to get to our same exact website. You can QR code it, you can tiny URL it, you can search Emory Primary Care Consortium. Any ways will get you to the same spot. And then also we have an email that's primarycare@emory.edu that's monitored by Shannon Thomas, who's super awesome, an Emory undergrad who's now out of school and working for us and helping to run this program. So if you had specific questions that, hey, look, not sure how this applies to me, maybe this is different, I'd like to know about that. One question that I got from someone who's interested in applying is that that individual had trained in medicine and pediatrics, and so is a med peds resident, and so asked specifically, can I practice 3 days a week in pediatrics and 4 days a week in medicine? And does that count as more than 0.5%, 0.5 effort? But the answer to that is yes, but I can imagine that you might have questions that won't be answered on the website. And certainly if you have a question that's not answered in frequently asked questions and you want us to address that and then repost it on the web, we're happy to do that. So again, primarycare@emory.edu. Give me 1 second. Just the website. If you get on a wide screen, you won't necessarily see the place, the call out for the Amos Medical Student Loan Forgiveness Program. You can download the PDF that you have in front of you already if you're in the room. This is a brief summary of the program. Eligibility, frequently asked questions, eligibility. This is kind of what you're eligible and application process. And if you come all the way down here, oops, sorry. Statement of interest form. There you go. There are your questions. Name, phone number, email. What year did you graduate? What program are you in? That's it. And then click send. Okay. That's the information from me to you. Now, what I really want to hear is questions, excitement, concerns, comments, thoughts about the philosophy, about how the program will roll out, questions that you have. Anything else that you'd like me to cover before we go into questions? Yep, please. Yes. Yeah, so that we've been asked this a lot in terms of, you're trying to anticipate the future and what's going to happen in the future, and your intention may be to pledge your primary care practice in Georgia, but circumstances may just work out differently. So we are asking for repayment of the money that you would receive if you're unable to honor your commitment. Your case would go in front of the selection committee, and they would work with you to understand what sort of mitigating circumstances there are and figure out what the repayment would be. And then they would work with you that way. Obviously, no one can control their future. At the same time, the integrity of the program is one of those pillars, is increasing the access to primary care in Georgia. Great question. For follow-up questions that you have? Okay, great, thanks. Please. Great. So the question was, if you're not selected at the time of your first application, are you re-eligible to apply subsequently? Yes and yes. Because we have a fall and a spring cycle, we also have the opportunity to carry folks forward who applied during the fall to the spring award time. So I'll just repost those timelines. So yes, if you applied during the fall and weren't accepted in the fall, we would carry your application over to the spring. If you weren't accepted in the spring cycle, you would be able to reapply the following year as well. We anticipate that folks have about 4 + 3 + 5 years. So folks have about 12 years of eligibility for the program. Let's say if you're starting as an MS1, you could apply this year, and you could apply your MS2, 3, 4, residency training 1, 2, 3, sometimes 4, and then the first 5 years of practice. So we anticipate that with 23 awards per year, that ends up being 115 awards, and we anticipate that probably 35 to 40 of those awards will be going to people who are receiving more than one award. Does that make sense? I mean, the newspaper kept asking us how many people will benefit, and we're like, it's a little hard. We wanted to maintain flexibility. There are some people who need $60,000 worth of relief. There are some people who need $300,000 worth of relief, and so it just depends. And then you had a question, and I saw you as well, and so we'll come to you next. Yeah, so the question was about, I gave the example of medicine pediatrics as a joint residency program, and there are other examples of family medicine psych, internal medicine psych, internal medicine, neurology, thanks. So those residency programs are not disqualifying, meaning that you'd still be eligible to apply. The proof of what you do after that would be kind of the, are you actually practicing in a primary care field? HRSA, H-R-S-A, HRSA has an online definition for primary care and an online definition for primary care settings that we follow. And so that information is in the frequently asked questions, because I think that, some very smart people gave us some previews about, hey, what questions do you have? And they're like, what's the definition of primary care? And so that's the definition that we use. And so, for example, some of my colleagues in geriatrics who practice in long-term care is not a primary care setting by the definition. A prison would be a primary care setting. There's something about longitudinal care and comprehensive approach that makes it primary care and team-based. So great question. So I think that the question for us, working with a selection committee for an application from someone in IM/neuro, is kind of what's your intended practice. Great, thanks for that question. Yes, please.
Okay, so my question was, so there's 23 awards given a year for a multitude of years. So if you were like to apply after residency, essentially, or during your residency, there would technically be less awards available.
Yeah.
I'm just trying to figure out.
Yeah. Okay, so let's walk through this because this is a really important question. Let me see if I got your question right for folks who are listening online. So the question was, if I'm an M1 and I can get up to 4 awards, when should I apply? So it's a 5-year program, and so your eligibility would be through M1, 2, 3, 4, and your first year of residency. So that's all the money that we know about right now for this program. And so the difference between receiving this money as a medical student versus as a graduate in a residency program is slight, meaning that you will get this as a tuition credit as a medical student. You will get it as income. I'm sorry. You will get it as a tuition credit as a medical student, and you will get it as income as a resident or someone in practice. So the tax implications are not fully understood by me. Please consult your own tax attorney. But this issue of probably a credit on your tuition is probably more advantageous than taking the money as income, we think. Yeah, and so that's the difference. I think the program is called loan forgiveness, but I think that there's actually a really meaningful component of loan avoidance, right? Because it's money that you never had to borrow. So if I can just riff off of that theme for a second. So Kathelen and Dan Amos were very inspired by what happened at NYU Langone with their tuition-free medical school. At the same time, I'm not sure of the societal impact of that program in terms of outcomes. I mean, a debt-free neurosurgeon versus a neurosurgeon with $200,000 of debt. I just think that that's a wash pretty quickly. But a pediatrician, I mean, I think that makes a big difference. And what is it that NYU is producing in terms of workforce? So this is the workforce targeted program. So it's primary care intentionally, and it's across Georgia intentionally. This is not as detailed as the state's loan repayment programs in terms of you must practice in this HIPSA area in this county with less than 50,000 people. But some of the goals of this program are the same, is to provide workforce where there's not workforce. Yeah, please. No. Let's take the first one, and then I'll come right back to you. So do the first one for me again. Great. So the question is, how soon after you graduate residency do you have to commit to your service in Georgia? And so we've been thoughtful about that, and I believe that we'll be very flexible about that. So for instance, someone might might wish to get training in HIV medicine, which is not an ACGME specialty, but it is a certification track, and it equips you to provide primary care for patients in a high area of HIV. So that would be eligible, and that would mean that you wouldn't begin your primary care service right away, as you suggested. We would want to know we will begin reaching out to recipients at the end of their training program to find out what they're doing. And we will work with people individually on plans. So let's try your second question. It was a good one too. Yeah. Yeah. So your question was, we talked about leadership opportunities and what would that mean, and could I, for example, get certification as a coach? So yes, and I don't know. So I think that when I was thinking about leadership opportunities, there are often sometimes student-sponsored events that actually provide you with leadership training while you're a student. This notion of I want to take some of this money and invest it in myself that equips me to do something different and better in primary care, open to that as well. There may be circumstances where people would want to receive this money as a medical student and would not want to put all of it against their tuition and might have shortfalls in terms of their living expenses and their book expenses that are not purely tuition. And we don't wish to be patronizing and telling you what you need to spend your money on, if you follow what I mean. Yes, please, question.
So just clarification in terms of the length of the program and the number of awards there are. So if you apply this year, you could receive up to 4 awards. If you apply in subsequent years, if you apply like 8 awards, then you would only be able to receive up to 2 awards.
So you are correct in that we have 5 years worth of money to award. And so my advice would apply as soon as you believe that you're willing to commit to the primary service in the state. That's advantageous. We do have some folks who are already in practice who plan on applying, and we do have some folks who are living in other states who would like to come back. And we are, I don't want to say we're indifferent, but we're recognizing that, you know, people are facing all sorts of different opportunities and constraints. We would use those selection criteria to come up with the best group of recipients. The short answer to your question is apply now.
So when you apply, you're applying for 1 award. And
Correct.
You have to reapply if you want it. Or like you're pledging 2 years of practice in Georgia, of primary care practice in Georgia. Is it the same award if you pledge 3 years? Like, or is that something else you have to apply for? Is that question?
Try it one more time. I think I understand where you're going, but just try it.
The more years you pledge, the more money.
Correct.
Is that
More
all-
money, more pledged time.
Is that all in 1 award? And like, is there flexibility in choosing how many years you pledge?
Right now, there's not flexibility on pledge service, meaning that you couldn't receive 3 awards and pledge 2 years. If you receive 3 awards, you would pledge 4 years. The notion that you don't pledge 2 years each time you receive an award is to try and actually make it reasonable for folks to anticipate kind of what they're doing with their lives and not pledge to be somewhere for 8 to 10 years. The question that you didn't ask that came up, if I may continue, is that let's say I get an award and I sign on for a practice and then I work in that practice and it just turns out not to be the right place for me. Picking another practice within the state of Georgia is allowed. You don't have to commit to an individual practice. The other thing that I'll say is that practices out there in primary care are often offering signing bonuses and loan repayment, and those offers to you won't reduce the amount that you receive for this program, and your employer hopefully will not reduce the amount of offer to you because you received money elsewhere. Also, other federal or state loans can be additive, and it doesn't affect the amount that you would receive from this program, meaning that you could string together something either by arrangements with your practice or arrangements with the state of Georgia or arrangement with other loan repayment programs that would actually make this a very easy financial pathway. Go ahead.
Another question, if you were to do your residency in internal medicine and then wanted to further subspecialize with some fellowship in PI, like with that, could you still come back and do this after another fellowship if you were intending to practice?
Yeah, so the question is, if you were to graduate from a primary care pluripotent residency in internal medicine, family medicine, geriatrics as a fellowship, or pediatrics, and then you decided to subspecialize, would we take you 4 years later to do your primary care? Honestly, unlikely, because the scope of the program and the duration of the program is to try and make an immediate impact on the state. So I think it's a great question, but that would be a selection criteria that would push someone lower on the selection. Yes, question.
Is that also in relation to geriatrics, since that fellowship is only a year? It was like after you do internal medicine.
Yeah, we recognize that that's a one-year fellowship, and we don't feel that that delays your service to an extent. I believe that GI is 3, possibly 5, depending on what additional procedural specialization you get. If you need to leave, it's fine. I'm not going to be offended, but I will stick around and ask and answer questions. And Portia, are there any questions that have been put online in the chat box? Okay, thank you. Okay. Okay, so the question was, if you received one award, would that have some sort of effect on the next award that you apply for? We would look at each application independently, and the factors that made you, thanks for coming. The factors that made you an award winner that first time are highly likely to elevate you again. There might be some people whose indebtedness is such that the first loan forgiveness award reduced it so substantially that they really don't have the level of indebtedness. But I looked at the bills the other day for this school, and that's probably not the case for everybody. Just saying. My med school tuition was $12,000, and it was a bear to come up with $12,000 because I'm old, and that was a long time ago. Please, question.
Like what we were saying, like say you went to a training after residency, if you wanted to do something like an MPH after residency, which could like affect how you practice primary care, is that something that wouldn't be like considered delaying your practice, or would you prefer like applicants practice if they want to return back to?
So your question was a good one, and that is that let's say you're on an MD MPH pathway, or you decide to do a freestanding MPH that takes you 2 years, and would that be considered by the program a significant delay in your getting to practice? I think that would be looked upon favorably, but I think that just the individual characteristics would be important. We do have somebody who's completed a family medicine residency who is now in a preventive medicine residency, same sort of thing, getting an MPH, looking at public health related aspects, practicing in a department of public health in a primary care manner would be looked upon favorably as well. Yes, question.
So sorry if you already went.
Don't worry about it. Just go ahead.
Given that the applicants are open to students, to residents, to already practicing physicians, when awards are given, is there a preference for those like residents and physicians, since they're more readily available to actually address primary care?
Yeah, that's a really great question. We've thought about this a lot. So given that medical students are, if you're an M1, you're 3 + 3, you're at least 6 years away from practice. And somebody who is deciding as a PGY3 whether they're going to leave Georgia or stay in Georgia, how do we weigh that as a committee? We think that taking money and applying it against tuition today is actually less money paid in taxes by the program, by the Amos program, to the federal government. And so that sort of balances out this issue about residents are so much closer to practice. For some people who have been practicing in the state of Georgia for 4 years, we ask ourselves, what is the incremental value of somebody who's already committed and anchored for 4 years of practice, whereas folks who are in medical school are constantly trying to figure out what it is that they want to do. And during the 3rd year, it's kind of like, this month I'm on this rotation, that's what I want to do. Next month I'm on that rotation, that's what I want to do. And I've been there, I've done that. So I think that people come into this program on equal footing. Yep. Please, question.
They have already answered this.
That's okay.
In terms of like subspecializing.
Mhm.
So I'm assuming like if you wanted to specialize
something that isn't within primary care, but for instance, like I want to go into pediatrics, but maybe emergency medicine, so PCM. I'm assuming I would have to serve at the term of my pledge first within pediatrics before I could subspecialize.
Yeah, so the question was, let's say I want to do pediatrics and then I want to subspecialize in pediatrics emergency medicine. That would fall under the HRSA definition of primary care practice sites in emergency room settings and skilled nursing settings. And some of those settings are not deemed, or in hospital settings are not deemed to be a primary care setting per HRSA, and we'll follow that definition. So yes, we would ask you to fulfill your pledge of service prior to going on and working in a non-primary care setting. It was a great question. Thanks. All right. Please let us know at primarycare@emory.edu if you beat the 48-second registration. It doesn't count for any money, but it's just something that we want to know. We've tried to make, and certainly if you get involved in this program and you're trying to figure it out and it seems hard or made necessarily too complex, please let us know. We're trying to make this as easy as possible for folks who are here and know that they want to do a primary care career and know likely where they want to go. And this just removes that one layer of concern. So thanks for coming today. I'm going to hang out for a little while, but we'll go ahead and shut down the recording in the Zoom. So thanks, everybody.